This case is a 74-year-old gentleman who underwent coronary artery bypass grafting several months ago. He now has a sternal wound. He needs to go to the operating room for debridement. Prior to going to the operating room, we're going to place an option filter, and after several weeks, we'll be able to take this filter out once we can anticoagulate the patient again. This patient has extensive deep vein thrombosis in his left lower extremity, and that's the indication for the filter. This is our option vena cava filter. It comes with a 6 French sheath, a dilator, and a curved pusher. The filter itself is loaded in a cartridge which is marked jugular or femoral. The sheath is very flexible and easy to torque and steer. The curved pusher allows centering of the filter in the center of the vena cava. The dilator has 2 markers which are 32 millimeters apart and can be used to measure vena cava diameters. There are also side holes at the distal end of the dilator which can be used as a flush catheter if necessary. So now we'll assemble our apparatus. We'll place our dilator through the sheath, and we'll exchange our diagnostic catheter out and place our sheath. So now we're exchanging over our wire for the 6 French sheath. And the sheath advances into the jugular vein quite easily, and we'll advance this down over our wire into the inferior vena cava. We'll now remove the dilator and the guide wire. Loading the filter cartridge is quite easy. Since this is a jugular approach, we'll take the side that says jugular, insert it into the valve of the sheath, and then we'll take our curved pusher, which allows us to use the sheath and the pusher to navigate into the cava if we need to. So now we'll advance with our pusher until we see the filter, and now you can see the filter coming down, and the filter is now at the end of the sheath. So based on our landmarks that we've used, we determined that this is a position that we want to deploy the filter. The filter is nitinol and self-centering, so deployment is relatively easy. We're going to pin the pusher and pull back on the introducer sheath. The filter is now deployed, as you can see. Now I'll use the wire on the end of our pusher to lead the sheath back into the vena cava a little bit inferior to where we are so that we can do a final injection. As you can see, the vena cava filter is centered perfectly in the center of the vena cava. And the deployment in this particular case was precise. This is a 64-year-old woman who presented with extensive left lower extremity thrombosis and the diagnosis of May-Thurner syndrome. She had an option filter placed in her inferior vena cava and then underwent successful thrombolysis and stenting of her left iliac venous system. 1 month after the procedure, she is now fully anticoagulated, and we're about to remove the option filter. What we have on the table now is a 10 French sheath, and we also have an end snare which we're going to use to snare the proximal hook on the inferior vena cava filter. Our plan now is to go down and hook the filter with our snare and retrieve it through the 10 French sheath. So fluoroscopically, you can see that we placed a marker catheter actually through the filter and into the left common iliac vein. We're going to exchange out our marking catheter, and we'll place our 10 French sheath. You can see our 10 French sheath advance down to a level just above the inferior vena cava filter. Fluoroscopically, you can see the filter in place, and you can see the hook at the superior aspect of the filter. Now you can see our snare coming down into position. So now we're going to advance the sheath, once we're hooked, over the filter and advance it all the way down until we get the filter loose in the sheath. And now, with the filter well within the sheath, we can now remove the filter. Our experience with the Option vena cava filter has been excellent. We've placed them for a variety of indications in a wide number of patients. What we've found is that the low profile is particularly helpful because we can use that in patients who are fully anticoagulated. The device tracks very easily over a guide wire, and we've had no problems with deployment. Retrieval also has been easy, and the self-centering mechanism of the filter allows for perfect deployment. That really helps when we try to retrieve the filter later on because the filter is always centered in the inferior vena cava.